everyone.
Hello. We're talking about health, helping to lead us to wealth, and we're having a couple of doctors come on tonight to help us. One of them did confirm with me this morning, so we shall wait for them to come on. I see one of them here. Dr. McDonald. So everyone, don't forget to put your city and state in the chat. Put your city and state in the chat so we can recognize you. And we're just going to take a couple more seconds here, get situated, let our guests come in to talk about health. And I'm on YouTube here. Hello, Dr. McDonald.
Hello.
How are you doing?
I'm good. Thanks for having me.
Absolutely. Absolutely. So everyone, don't forget to put your city and state in the chat. And Tawana, I don't know if you're able to see. Oh, we have a little bit of feedback. We have a lot of feedback, actually. Let's see. Make sure it's not on my end. Okay. Oh, I still have feedback. I don't know where that's coming from. Oh, yeah, that's better now. Eric, must be you. So whenever you talk, I'll be quiet.
It wasn't me.
Okay, I don't know what happened. But anyway, so we want to say hello to everyone tonight. We've got India. No, I still hear feedback. It's somebody else. I don't know. Maybe Dr. McDonald. Maybe if you could go on mute for me. Okay. Yeah, so I don't hear any more feedback. So when Dr. McDonald is talking, I'll make sure to put myself on mute because I don't know what's happening there. But hello to Indiana, West Palm Beach, Florida. Oh, Dr. Keisha's here. Hold on a second. Let me make sure we get her up to talk about wealth and health tonight. So we've got Frederick, California. We've got Ryan at Bowie State. Ryan, you're doing so many great things. We need to have you on the panel one day because I know that some of the stuff that you're doing is super awesome in the blockchain and tech space. So, and he is the co-founder of the Bowie State University Blockchain Association. So we definitely have to have our HBCU represent here. We've got Laurel, Maryland. We've got Mount Vernon, New York, Georgia, Detroit, Montgomery, Alabama, San Francisco, Jacksonville, Bronx, Lancaster, California, Jonesboro, Georgia, San Diego, Woodbine, Georgia, another San Diego. We got Philly in the house, Lenexa, Kansas, Indianapolis, Kalamazoo, Michigan, the Philly area, Los Angeles, Augusta, Georgia. Hello, everybody. Welcome tonight to the 10K Project. In order for us to get wealthy, because you know we're all about wealth here, Black economics, as well as investing and entrepreneurship, we can't do that with unhealthy bodies. And I will be the first person to say I need this like more than anybody. So when we were speaking with our publicist, Neil, about some of the people we could have on and what prohibits us from having wealth and wealth at its fullest, health came up on the list of things that we within the community really need to do. So thank you so much, everyone, being here. I see Atlanta, I see Chicago, Dallas. Hello to everybody. So what I want to do tonight is a couple of things. Number one is I am going to talk for 3 minutes about the 10K Project. I'm going to talk for 3 minutes about the Family Wealth Challenge, give you a little peek into what's going to happen for the Family Wealth Challenge. I can't even tell you everything. Next week, we're going to talk about it all. And then I am going to have Doctors McDonald and Wardlaw come on to have a conversation with us. So I don't see Dr. Wardlaw's name, Elena, if you can tell me exactly what name it's under, because I'm looking under DR and Wardlaw and I don't see either. Thank you. I was looking for that. Okay, so I am going to I'm going to share my screen for a second. And okay, so welcome everybody. If you are new to the 10K project, you should know that we are a community of Black people who come together in order to talk about investments, entrepreneurship, buying assets, and generational wealth. Our dear friend Eric, who is also here on the panel with us, brought something to us called the 3.5% rule. And it's a study that was done that talked about in different countries how massive social change happens. Turns out you only need 3.5% of a community to lead to massive social change. Well, what we've done is we've said, well, we probably only need 3.5% of the Black community to lead to massive economic change. That's 1.3 million of us, and we believe that we can have it as part of the 10K project. So there are a couple of things that we're doing. Number one is a lot of education with regards to wealth building, entrepreneurship, buying assets, family banks, which is what our Family Wealth Challenge is going to be about, and generational wealth. So tonight's conversation is one of those conversations. You can go to our calendar of events and check out any and all of the events that we have. It is at the10kproject.com to check out our calendar of events. The calendar is pretty much full through November, and we actually have December pretty full as well. So we've got a lot of content coming for the community. An example of a member webinar, because not all the webinars we do are open to the public, is of course our Starting the Family Bank webinar with Robert Cook and the late Colonel Frank Preston, who joined us to talk about how their family started with $25 per family member per month and grew it to 7 figures in cash and assets. So but we have someone come on talk about investing in hotels. We've had a lot of great people come on to talk about different facets of increasing your income, buying assets, etc. So you can become a member. Come to the10kproject.com. It's a one-time payment of $100 and you get access for life to all of the wealth building content and webinars we have, the business building webinars, and the Business Directory and Knowledge Center coming up in the next couple of weeks. But wait, there's more, because we have applied to do something called equity crowdfunding. It was a law that was signed by President Obama in 2012 that said that regular people like you and I could get together through an SEC and FINRA approved company that has something called an equity crowdfunding portal license. And what we're able to do is this. As a company, Black entrepreneurs are able to apply to us and through the SEC in order to raise the funds that they so desperately need for their businesses. And the companies, if they're approved, they will pitch their business to the entire community, all of you as potential investors. If you like the business, the minimum investment would be $100 per person to put into the company in exchange for partial ownership or equity in that company. If the company makes it, they do well, they win big, then the people who are partial owners, the shareholders in that company, win as well. If the company doesn't make it, then all you lose is what you have put into that company. But it is a way for us from the bottom up to be able to start funding our own company. So that's our big plan, our big master plan. And we have already gotten our check mark from the SEC. We're in the process of finishing up our filing with FINRA, should be done by the end of this week. We've hired counsel who has helped other companies get approved to be equity crowdfunding portals. And we're talking our counsel like 2 to 3 times a week. Tawana's probably on the phone with her or emailing her every single day in regards to this. So that's our big master plan. And by being a part of the 10K project, you get to support us as we're going through this process of becoming an approved equity crowdfunding portal. So when 10,000 people come together, put in $100 each, that's $1 million that a company can raise. The community can start funding its own companies, profiting from its own innovation, creating jobs, and building Black wealth. That's where the 10K project name comes from. So again, if you want to become a member, you want to get all of this knowledge, content, and you want to also help support us with regards to us getting approved with the equity crowdfunding portal. We'd love to have you as part of our community, the10kproject.com. Tawana, did I leave anything out before I talk really quickly about the Family Wealth Challenge, and then we're going to have our guests talk?
No, ma'am, you are a pro at this.
I'm a pro at this. Good. All righty then. So let me come here, and I just want to show you. Hold on. I want to make sure that I have the right thing up before I mess it up. Here we go. Okay. So I want to make sure that I showed the right thing. Here we go. So put a 1 in the chat if you're ready for the Family Wealth Challenge. Put a 1 in the chat. I'd love to see some 1s in the chat. You're ready for the Family Wealth Challenge. Good. If you're wondering what the Family Wealth Challenge is, we've had a very character building year in the Black community. We want to end the year wealthier and more aligned leaving 2020 than we came in. So we are doing something called the Family Wealth Challenge, and the goal is for us to put our family banks together. Now, this isn't everything you're getting. This is just a snapshot and a preview of the 7-week masterclass. And I will say, for whomever is already a member of the 10K Project, you're grandfathered in. If you're not a member of the 10K Project and you just see this and you like it, please become a member of the 10K Project. You'll be grandfathered into this and so much more that we have. So we are going to have a 7-week masterclass, and the point of it is to help you learn overall how to set up your family bank, and also give you the resources and the tools and a t-shirt to celebrate this. And by the end of 2020, hopefully you would have your family bank set up. So it includes Monday, November 9th. All of our sessions are going to be Mondays at 8 p.m. So come here to Fireside Chat, and then you stay for the masterclass. We're going to have an overview introduction discussion about starting a family bank. It is based on the book Family Wealth by James Hughes Jr. Monday, November 16th, we've already spoken with Calvin Williams. He is a phenomenal wealth planning coach, and he's going to come in and talk about creating a family wealth plan. Monday, November 23rd, we have 2 women coming in. Esther Boykin is a family therapist, and Desiree Fisher is an estate planning consultant. She's not an attorney, but she has some experience helping her father go through the estate planning process. And she also has a lot of resources to estate planning attorneys that understand us culturally. So that conversation is going to be, how do we have those tough conversations? I can't believe that, you know, Aretha Franklin and Chadwick Boseman and all of these people died without wills. We have to figure out how to talk to Big Mama, you know, our parents. Some of us don't have parents, that's the issue. Some of us have siblings, that's an issue. How do we have those tough conversations? Then on Monday, November 30th, we have Pete Singh and Jessica Smith coming on to talk about the setting up of your entity and your accounting setup. December 7th, you need to know that there are tax advantages to getting your family bank set up. So I've got two great CPAs, Raquel Mack and Florice Gregory, coming to talk about that. Some of the things that you can deduct. Some of you will be able to reduce your tax bill just by setting up a family bank. On December 14th, Florice is coming back to talk about how to read your family bank's financial statements. And then on December 21st, we've got Maureen Murat, who is an attorney, and Tamara Tolbert Bush coming in to talk about how to overview of how to operate your family bank and some of the things that you can invest in terms of assets in your family bank. Put a 2 in the chat if you're excited about that lineup. And I hope people are. So I know that the other doctor was here. I see a lot of 2s, fantastic. So we are going to have a full hour discussion, probably plus, next Monday at 6 p.m. to go through everything, because that's not all. There's more added to it than this. But we're so excited. Okay, so I see a lot of 2s here. I'm super excited. People are ready to go. This is a time for you to tell your family, friends, everybody about the Family Wealth Challenge. Another question that we get is are people able to come in if they don't have a family? For whatever reason, you don't want to do it with your blood relatives, you're single, etc. The answer is yes, you absolutely can do it as a single person. If you choose to, absolutely can. So Dr. McDonald, I still don't see Dr. Wardlaw. Dr. Wardlaw, do me a favor. I believe you're in the chat. If you can raise your hand, it'll be easier for me to find you. I'm so sorry. I can't see you. So, and then we're going to talk about health today. And I think we lost both of our guests here. In the meantime, Tawana, how are you doing, my dear?
I am as tired as I am and as emotionally stressed. So I hope we get to the emotional health conversation tonight, because that's the piece I need. I am blessed and I can't complain, but it is, it's a lot. It's a lot going on around us. It's just a lot. And I can tell you this year of 2020 has been a trip. Like I don't want to wish the year away, but Lord, I'd be happy when this is over. Just bad news after bad news all around about people, and it's just a lot going on. But
yeah, we had
abundance even with all of that.
Yeah, we had within our group, we had Colonel Frank Preston who died, and then there were 2 other people who died unexpectedly in that group. I knew that Colonel Preston was ill, but I wasn't even expecting that, and I took that a little hard, right? And then we had 2 other people from that group as well. So it just it really did hit this year. Just a lot of stuff happened this year. That's why Latrice is saying 2020 is a doozy. Yeah, but you know what? We can turn it around the last 8 weeks, and that's where this Family Wealth Challenge is, I'm inspired. So Capri is saying good news at the end of the week. Good. Anderson is saying praying for us all. Dr. Keisha, I'm sorry, we have a question here. When we set up these platforms, will there be consulting or coaching program to make sure we build and maintain our family plans? Yes. So Calvin Williams is going to talk about that. And not only is he going to talk about it, he is about it. He already has a program in place for families that want to have wealth coaching and wealth planning as a family. That was one of the reasons why we reached out to him and asked him to to do this for us, to give this presentation, but he's not the only person that's going to be on the resource list that you're going to get. There will be other professionals, and we wanted to make sure that we had as many Black professionals as possible. So I think definitely all of our speakers are Black, but I think all the professionals, or most of them, will be Black as well. And they understand us culturally, because we know we go in sometimes and people will say, why don't your uncle give you $100,000? And we're looking at each other like, what are you talking about, right? So, Dr. Keisha, how you doing?
I'm well, and I have to echo entirely what Tawana was saying. I'm a public school teacher, and man, it's just been really, really something. But I'm also encouraged. I'm really inspired. Speaking of health issues, I'm a special education teacher, so I work with people with disabilities and real physical situations. But the biggest thing that I'm finding is that social, emotional health right now is the thing that is the transferable piece that's getting us over, if you have that in place, so that's really, really important, truly. So I'm excited about tonight's conversation, and I made sure I changed my doctor to PhD on the end there, because I'm not the MD tonight. So we can change that over.
You don't want people to get it confused, right?
No, let's not get it twisted. I am not the MD in the house.
Oh my goodness. Dr. McDonald, can you hear us?
Yes, I can hear you guys. Can you hear me?
We can hear you. We can't see you, but that's okay. We want to maximize our time with you. And I'm so sorry I don't see your sister. I've asked if she can raise her hand in the system, in the Zoom system. I'll be able to see her more easily.
Yeah, she said for some reason they asked for a code. It's under Dr. D251 at Gmail.
Okay, so I have the code. I'm going to send it to you.
Okay.
Privately here.
Perfect.
And
did you say there was a Fuller too who was supposed to be on? Because I see a Dr. Fuller.
No, it's not
okay.
Dr. Fuller. He was on last week.
Okay.
There you go, Dr. McDonald.
Okay.
I just
Perfect.
sent it to you.
And then I will okay, I'm going to send that to her now, and then
Absolutely.
I will start talking. And I'm not quite sure. I'm not sure if I'm having trouble with my power, but it kept going off and on, which is why I kept getting kicked out of your meeting.
Okay.
But I'm here now, so.
Okay. Well, you know what? We're going to just look. We know how to roll punches around here. So,
exactly. We're going to keep going.
We understand how technology works. So
yes. So I when it kicked me out of the meeting, I missed the last few statements in your conversation. So I just want to make sure I pick up at the right place.
So it's been an emotional year for us. I've personally, with the group that I belong to, there were 3 deaths, 2 unexpected and 1, kind of expected. But one was a mentor who actually came and spoke to the 10K project. So it hit me very hard that he died 2 months after he came to speak to us. Mm-hmm. And then Tawana's been saying it's emotionally difficult for her. Dr. Keisha is a special ed teacher. We have other people in the chat saying they can't wait for the election to be over, which I totally understand. Let me tell you, I love YouTube. I bought the YouTube Premium just to not hear the ads, because I don't want to hear it, so I definitely understand. And, we just had an emotionally draining 2020. So we would love for you to talk. Oh, did the doctor get kicked out again?
No, she's there.
I'm here.
Oh, okay.
I'm here. Yep.
I just didn't see you're in the frame anywhere. Okay.
Yes.
So we would love for you to talk about health. And don't forget the emotional and mental health piece of it, because I think that, that is a big part of what we need as well as we're building our wealth.
Mm-hmm.
Well, thank you for having myself and Dr. Wardlaw, who's my twin sister. We go by the name of Twin Sister Docs. We are board certified. I'm a board certified pediatrician, and she is a board certified family medicine physician. And we've been practicing in underserved communities for about 20 years. And when COVID came along, COVID really, we became a little bit more well-known as we started to do some volunteer testing. We had some local and some local media and national attention. And our goal is to really get the word out about healthcare disparities and, helping people realize that, African Americans really don't trust the medical establishment. They don't trust the government. They don't trust anything that's really going on around us. However, and it's for valid reasons. We know going back in our history, the Tuskegee experiment, Henrietta Lacks cells, the Holmesburg experiment, African Americans just have this distrust. However, we do not want that distrust to leave us out in the cold when it comes to managing our health. The COVID-19 pandemic has really just magnified what we've known all along, is that, African Americans are disproportionately affected by, cardiovascular disease, diabetes, hypertension. And when this pandemic came along, coronavirus does not discriminate. However, because we were dealing with so many other things, from systemic racism, economic disparities, healthcare disparities, it had a disproportionate effect on us. And we're now trying to figure out, now that we know this pandemic isn't going anywhere anytime soon, trying to figure out how do we get through this pandemic. One, our physical health, which is extremely, extremely important. So making sure that we are getting to our routine doctor's appointments, making sure that we're getting our colonoscopies, making sure we're getting our mammograms. The screening test dropped drastically. Initially in the beginning, we were on lockdown. That had to happen. But now that we're no longer in lockdown, we need to learn how to get back to the business of taking care of our health and managing our chronic illnesses, because ultimately this is a once in a lifetime pandemic. So we will hopefully not see the likes of a pandemic like this again, but we want to learn from this, and we want our children, our grandchildren, our great-grandchildren to be ready when another pandemic comes around again. And in addition to, Dr. Wardlaw is the family medicine doctor. I'm the pediatrician, so I go from ages 0 to 21. We want to make sure that, in addition to adults making sure they're dealing with the pandemic, we have to have our children deal with a pandemic. Just like, mid-March, the whole world was just turned upside down, especially here in the US for us, when we realized that the pandemic was actually here. Now, for our children, us as adults are having a hard time dealing with it, but for our children, everything that they knew was taken away from them. I mean, and in a matter of 24 hours, my 13-year-old son was sent home with all his school books, told he couldn't come back to school. He couldn't play on his sports teams. He couldn't go visit his parents. He couldn't go to go out and hang with his friends. Everything was taken away, going to church, everything was gone. And children are very resilient, but this is something that they had never seen before. So paying attention to your children, and mental health is a huge aspect of dealing with this, this pandemic. Children may not come out and say, I'm depressed, but you may notice a change in their sleep pattern. You may notice a decline in their schoolwork. And the decline could be not only because now all of a sudden they went from being in school to virtual, but also, they're just not focused as much anymore. Your chatterbox is now more reserved and not talking. They're angry. They're acting out. That's the child that you really need to look at and say, okay, are they dealing with this the way we expect them to deal with this? And it's very hard. So you want to make sure you talk to your children. You want to explain to them what's going on. Sometimes we as adults go on with the business of our lives, but we're not paying attention to our children. So we definitely want to pay attention to our children, allow them to be angry, allow them to be upset. Children want to be in school. There's so much more that they're missing academically from not, missing from not being in school than just academics. So, in addition to paying attention to our children, we also want to make sure that we as adults are taking care of ourselves. If we are not here, who's going to take care of our babies? Who's going to take care of our babies? So, the pandemic forced us all to slow down, But we also started joining Zooms all the time, all these conference calls. So we went from one type of busy to another type of busy. So trying to figure out how to take care of yourself. And it's okay where people are stressed, people are anxious, people are nervous, because we really do not know what tomorrow really holds when it comes to this pandemic. So what I will say is that, you know, as you talk about wealth on this call, your health is your wealth. Without your health, we really can't talk about anything else. So we want to make sure that we are taking the time to get in to see our docs. If we are feeling stressed, make sure we're reaching out to mental health professionals, because they are out there to give us to help us with the coping skills we need to get through this. Because again, it doesn't matter how much money you make if you're not here, you know, to enjoy it. And of course, you know, we when we talk about building wealth, we want to build generational wealth, because we want to pass it down to our children. We want it to pass from generation to generation to generation. But you have to be here in order to make it work. So those are the most important things that we want people to realize. And as we forge forward, we're about 8-9 months into this now, not becoming complacent. You know, we're getting that COVID fatigue. We're tired of being in this funk or conundrum, as I call it. But if we become complacent, it could literally cost us our lives. You know, you mentioned on this call that, you know, you lost a close person. We've all, at this point, I would be very confident in saying we've all have been affected. We know someone who has contracted this virus at this point in time. So we just want to make sure that we are taking care of our health. So if you do not have a primary care physician, please make sure you find one. If you're not, again, trust is a big factor. You need to trust your physician. If you don't trust your physician, it's hard to have a dialogue with them. It's hard to explain, to ask questions, because you want to have that dialogue. You want to advocate for yourself. You know, when you feel comfortable, you advocate for yourself. That leads to more transformational outcomes. Mm-hmm. If you do not trust your doctor, you don't believe what he or she is saying, you don't think they have your best interests at heart, you're really not going to do the things that you need to do. Or if you don't understand them and you don't feel comfortable talking to them, then that's a problem. You know, if I explain to you, you know, okay, you have high blood pressure and you need to first work on your physical activity, work on your diet, but then we also need to get you on certain medication. And this is why. If people don't understand the why, it's hard to get them to do what you're asking them to do. So as you forge forward and you try to find a physician, talk to your family, talk to your friends, see who they go to, see who they have a good relationship with, so that you can go in and you can start to focus in on your health. For people who don't have insurance, you know, each state has free clinics that you can go to, but we have to start from somewhere to manage our health. You know, African American women, we have a lower rate of breast cancer, but we have a higher mortality rate because we're being detected at a later stage. White women are detected at a much higher rate, but they're detected at an earlier phase. And when they're detected at an earlier phase, their outcome is much better than ours. So as we are in the rat race and we're ripping and we're running, you know, and it's not just with breast cancer, you know, it's with cardiovascular disease, it's with diabetes, it's with high blood pressure, it's across the board with so many chronic illnesses. And as we're on this rat race, trying to take care of everyone else and making sure we're doing all these other things, we must take care of our health. Because, and as a pediatrician, I tell my parents all the time, if you're not 100%, how can we expect you to take care of your children? Your children feed off of you. Your children, sometimes they do what you say, but they always do what you do. They are watching you. They notice when your mood changes. They notice when you're upset or you're stressed. And it's okay to have those feelings because we're all human. But we just want to make sure that we are reaching out to the right people to get the professional help. And when we deal with mental health, African Americans, there's a stigma with mental health. No, we all have, everyone could have mental health issues. So you want to be able to identify it, to recognize it, have the resources to go request the help that you need to move forward. We're seeing more and more teenagers become depressed. We're seeing more and more teenagers try to attempt suicide, and some are successful at it. So we have to recognize all of these things in order for us to start to live our best life. Because again, none of this financial wealth matters if you don't have your mental health and your physical health.
Amen to all of that.
Mm-hmm.
So I have a ton of comments and questions based on what you've said here. I'm gonna start with the elephant in the room, and that is the distrust of doctors. So during this COVID crisis, we saw news story after news story of Black people that went to the hospital and would turn away. Black people who went to the hospital and were given an aspirin and told to go home. How are we expected to trust the medical system if we don't already have a primary care physician when we watch the news and we see this? Now, fortunately, most of us in this specific community, the 10K community, either have insurance or we have the financial wherewithal where we can, and we do have options. But some of us have family members that don't have those options, or we're like, forget the system, because we're looking at this and we're looking at how other people are treated and mistreated. What would your response be to people's concerns about that?
Very, very, very valid concerns, because what we saw, I'm in the Philadelphia area. So what we saw was not only were people in lower socioeconomic classes unable to get the testing done, we were seeing people who were middle class who, just could not get access to the testing. Mm-hmm. So, Dr. Wardlaw and I, we initially the first few weeks, month of the pandemic, we volunteered to help go out and provide testing to people in some of the most vulnerable neighborhoods based off of the data that we were getting from the city of Philadelphia. And we would go up and we were part of a team that would go up and set up shop, and people would come because the people who were out there testing them looked like them. So not only, trying to get past the trust factor, but the healthcare system itself has to recognize what we call implicit bias. So as you already mentioned, someone says they go into the hospital, they have chest pain. We all know the African-American male, African-American female are more likely to be told that it's reflux or, musculoskeletal, but someone of another ethnic group will get an entire workup. They will see the cardiologist, they'll get an EKG, they'll get the echocardiogram, they'll get a stress test if they need it, they'll go to the cath lab, if they need it. So the healthcare system has to recognize the implicit bias, and they have to appreciate, and they have to be vested in African-American lives also. So not only, looking at small physician offices, large institutions, insurance companies, everyone has to be all in, because again, the ultimate goal is to improve our outcomes and ultimately improve the quality of life of African Americans. That's really the ultimate goal. And what I do tell family and friends, do not let your distrust of the medical system leave you out in the cold. You need your treatments, you need your preventative cares, you need all of those things to maintain your health. So start with looking at, societies of African American doctors near your zip code, reaching out to those doctors where you can go and where you feel comfortable with. Because at the end of the day, you really have to feel comfortable. You have to be able to make the connection. Physicians have to be trained about cultural sensitivity. Physicians have to be trained about, social, determinants of health. People have to realize all of the things that people are dealing with. Some patients are considered non-compliant, and maybe they couldn't get to their doctor's office because they didn't have money to catch the bus. Or maybe they couldn't get to their doctor's office because now all their kids are home from school and they just can't bring them all on the bus, right? Or maybe it was pouring down raining and the bus just didn't, the bus was late, running behind schedule, or I needed to feed my family. So I couldn't afford to come in that day. Some people are dealing with short-term immediate problems. So they push their chronic problems to the back burner. So there's a whole lot of things that have to be addressed, right? We need to make sure that, we have equal education systems, when that in turn will decrease the socioeconomic disparities, we need to make, and then again, equal education system, leads to better healthcare, leads to improved outcomes. So there's a multitude of things that have to be addressed when you're trying to improve the outcomes of African Americans.
That's right. So Anderson just found a site called blackdoctor.org. I haven't checked it out, but our community is always on it with resources. So thank you so much to Anderson for putting that on there. Connie asked if this is going to be on YouTube so she could share it with specific family members. Yes, it's streaming there now. So we're at Black 10K Project on YouTube. You can go find us and get access to all of our fireside chats and all of our public content as well. So I want to also talk. Yes. Oh, I'm sorry. Yes, sir, Eric. Yes.
Yeah, I'm sorry. I got one question. I just wanted to pose it out to Dr. McDonald.
Sure.
Listen, one big thing that I don't think is addressed enough is that often patients, when they enter into a doctor's office, okay, they're not the one with the medical degree. So many times they feel a bit intimidated. What do you say about patients of helping them to where self-advocacy is a very important component, but could you speak on that a little bit?
So Eric, I agree with you 1000%. When you go into a doctor's office, we're the professionals. It is really our job to help you understand what is going on. And when you understand what is going on, you're more likely to follow through with the things that you need to do, or have a discussion and say, well, this is why I'm concerned about doing this, doc. So you want to feel comfortable. So I put myself in a different situation. So for example, when I go to the mechanic and I drop my car off, my car's not working. He's telling me about the carburetor, the transmission, and the alternator, and all I want to know is, can I drive my car? Did you fix my car? It needs to be very, very, very simple. Same thing with physicians. You don't want to feel intimidated. You just basically ask your basic questions. What is the problem? Why am I having this problem? What are the steps that I need to take to solve this problem? And when do I need to come back to see you? What tests need to be done? So, and if you don't understand, don't feel intimidated, because sometimes we as physicians, we get so used to having our typical conversations that sometimes we start to use words and terms that you may not understand. Mm-hmm. And that's when you need to step back and say, doc, I really don't understand what you're telling me. Because then it's my job to say, okay, let me play this back. Now let me tell you a different way. Because if you walk out that door and you don't understand, I've done you a huge disservice. I have not done my job. Okay. So when you go into the office, yes, you want to advocate for yourself. You want to ask basic questions to get the answers that you need to move forward.
I'd like to add something to that, just very practical. I had a doctor's appointment and the doctor gave me a diagnosis. It was, a skin thing, so it wasn't super serious. But she gave me a diagnosis. I pulled out my phone and I opened up the notes and I said, spell that for me. And she spelled it. And I went over the spelling again. And then I went home and I researched what that was. Sometimes I'm going to be honest with you, Dr. McDonald, some of these doctors are drive-by, they've got the insurance companies harping on them, mm-hmm. and you want to do advocacy for yourself. You do want to push it. However, the doctor's like, look, I got another 5 patients over here. So what we also want to do is suggest to people, you spelled that medical term for me. Like, did I spell it right? And I got that actually from my grandmother. Shout out to Mama Dell. She died when she was 96, but she would do stuff like that. And she would pull it out And then she would, you know, she didn't use the internet at the time, but she had her resources and her ways, because we had a family friend who was a doctor, of figuring out what stuff was. So that's another practical thing I think that people can do when they're at the doctor. I want to also.
And Cherie, can I just comment to that?
Oh, yes.
So absolutely. Do you want to be able to write it down, or also ask your doc, do you have a handout on that?
Mhm.
No,
Oh, that's good.
can you write it down for me so I can go home and do, look it up? And that's absolutely fine. But then guess what? There's also follow-up appointments. You may not get everything answered that day, but you need to be able to say, hey, can I reach back out to you? I need to set a follow-up appointment so I can come in, or the doctor may say, I need you to come back and see me in 3 months so we can check in and see what kind of progress you're doing. If anything happens in between, call back. But sometimes you do feel rushed. Oh, I get it. I work in the private sector, so I understand, the pressure that can be put on people. But ultimately you need that working relationship with your doctor. What you don't want to do is just walk out that door and be like, I'll figure it out on my own. Mm-hmm. Because ultimately they're there to help you. They're there to help you figure it out.
Yeah. Now, what
and
about
establishing
telemedicine?
a relationship? Oh, I was going to say establishing a relationship with the doctor is important also. And anyone who knows me knows I had 1,000,001 questions, right? Mm-hmm. You very rarely can say something to me without me saying, help me understand that, or asking a follow-up question. It's how I learn. And so over time, my doctor has learned that about me, right? And so we don't do the 15-minute sessions because she knows Tawana's not going to be in and out in 15 minutes, right? So she spends a little more time with me if it's a visit where she knows I'm going to have some questions, but we've taken years to establish that relationship. Mm-hmm. And so it is truly about having a family doctor, someone who knows you, someone that's invested in your care, not going to urgent care and utilizing that like a primary care physician, not running to the ER when it's going to be a different doctor every single time. We have to start getting serious about our health. And you have a team, right? We have to talk about business. We talk about the team. Well, when we talk about health, there should be a team as well.
Yeah.
Absolutely.
So Kim is saying here, our family has a second family member attend or call into the appointment and scribe for the family member being seen and sometimes ask questions. We use the buddy system. I love that. Nice. Especially with our older, like when my grandmother was alive in her 80s and 90s, my mother would do that. She would call in, she would call the doctor after hours and, all of that stuff. So yes, I do want to come back to something you talked about, Dr. Elena, that I believe is very important and people may not have caught it, and that is COVID fatigue. Okay. This past weekend, I went to the grocery store, and I am in Maryland, where it is mandatory in our grocery store for us to have our mask on. And I was pouting. Oh my goodness, I'm so sick of these masks and, all of this. I do think, and you said that, I have to paraphrase it now, but when we're so fatigued that we may, take our foot off the gas, and I'm going to call it get lazy with our COVID protection. We do Black Money Daily every day, which is our podcast, about 10-15 minutes. And the White House Chief of Staff, we're not partisan here, I'm just making a comment. The White House Chief of Staff this weekend said that the pandemic isn't going anywhere and they're not focused on or worried about it spreading. Okay. That's the way they're running right now, their policies with regards to this. We have a lot of frontline workers in our community. My biggest concern is COVID fatigue and us taking our foot off the gas with our extra precautions that we know we need to have because of comorbidities, et cetera. And all of a sudden you're sick because just like we can't depend on the government to help us in certain ways, in certain circumstances. This is one of those things as well, where we're probably as Black people going to have to wear our masks longer than anybody. Everybody else be running around, and we may have to say, look, I'm going to need to keep my mask on another month to make sure this thing doesn't spike again.
We cannot afford to be lax with this. We cannot afford to be lax. We have to stay vigilant with this.
So Cherie, I am glad you went back to that because, okay, our leadership has failed us when it comes to managing this pandemic. Okay, so we can talk about big government, but at the end of the day, each individual has a personal accountability to do what they need to do to stop the spread of this virus. So wear your mask, social distance. We've been doing this 8 to 9 months. If you're going somewhere, if someone doesn't remind you, that doesn't mean, oh, we don't have to do it. You know, make sure you put your mask back on. So again, we're trying to save ourselves. Okay. What the president got, that's not readily available for everybody. So let's recognize that. Okay. And we don't want to walk around and act like it's not happening. Oh, 200,000 people have died. This is not a hoax. This is not a hoax. And this is a deadly virus. And we need to move and act like that. The one thing I want to focus on is that we tend to let our guards down around people that we know, we trust, we love. You can't do that. Your coworkers, your friends, your family members who live in different homes, because we all go our different ways when we leave each other or before we come around one another.
Yeah.
Multiple people have symptoms from COVID, but there are hundreds of thousands of people who don't have symptoms from COVID. They're asymptomatic. So you really have to move in a manner that you can get COVID from anybody that you are in close contact with that does not live in your home. So we need to move like that. You know, small gatherings. It's just an event, 15 of us, but you're coming from 5 different homes, 5 different locations. Yes, you're good friends, but somebody could be carrying that virus. So you have to protect yourself at all times. We know that children don't carry the burden of the disease as much, but we know that they still carry it. And you don't want to take, you have to be careful because you don't want to take it home to an adult in the family who has a chronic condition, who's more susceptible to severe complications, or your grandparents. So we have to be very careful when we continue to try to navigate this virus.
Right. So I see Katie Davenport, you have your hand up. Please put in the chat if you really mean to have your hand up, if you have a question. I don't want to put you on if you don't have, okay, you put it down. Chris is, I want to make one more comment before I go to Chris's comment. I'm not partisan here, but don't think if Biden gets in that's going to solve the problem. Okay. I love you.
Well, I think the answer is that we can't depend on anyone to solve this problem for us.
We cannot depend on anyone. Yes. So Chris is saying here, do you suggest we go about the holiday season as usual or probably cancel big gatherings with family? That's a great question, Chris.
Chris, the holiday season is not going to be the same, at least not this year. Because if you're used to, again, to big gatherings, people coming from different towns, different states, you're all coming from different locations, it's an exposure risk. It increased the exposure risk. So no, Thanksgiving is not going to be the same. Christmas is not going to be the same. Whatever major holiday you celebrate with large gatherings, we just cannot do it at this point in time. Hopefully next year, things will be different. Hopefully. But this year, we have to make these adjustments because, again, we're trying to save our own lives.
So Katie asked, and I'm so sorry to hear about this, Katie. So both of her children have had COVID. Is there any more info on the rash that has been ID'd after having had COVID? Is her question.
So right now, there is not a whole lot more information on that particular rash. So you have to remember, we're still learning a lot about this virus, as we gather data and we synthesize the data. Some children have rashes, some children, get acutely ill when they actually have the disease. Then some children get sick, what they call the post-viral syndrome. The multi-system inflammatory syndrome, where these children were really getting sick and it was affecting their heart, when they were admitted to the hospital. So I don't have more information on that particular rash. But we do know that children can still present with a multitude of symptoms.
So again, I'm so sorry, Katie. I hope that your kids get better. Latrice is saying, yes, my son's friend tested positive and was exposed to my son. So our household quarantined just to be on the safe side. All of us tested negative, but none of us have had symptoms. Well, thank God for that.
And they did the right thing. You're
Yes.
exposed. You must quarantine for those 14 days.
Yes.
Okay, there's somebody I know who should be quarantining now, but they're not. But you must quarantine for those 14 days. Even if you are what you consider yourself an essential, an essential worker from the White House, you must quarantine.
Yeah.
And I'm glad you emphasized the 14 days, not 2, not 4, not 7, right? 14 days.
14 days.
SC, I hope I'm saying your name right, is saying, I am a physician and an anesthesiologist. We need to take our health into our own hands, avoid animal products, exercise, and manage stress. I agree with that. I want to talk about exercise for a second because the doctor also mentioned the Zoom meetings. One of the things, and Tawana knows that she's probably going to laugh, is we within the 10K Project tend to have a lot of meetings. And fortunately, I own my own business, so I know that I'm blessed in a way that maybe some of you are not. But sometimes we do need to go back and look at our calendars and ask questions of our bosses like, hey, does this meeting really need to be an hour for us to have a meeting about having a meeting? Using some of the tech tools that are out there, and I know that Talisha will come in and help us with some of these as well, where everybody gets on the same calendar or has a poll of, what day can everyone meet? And then you've cut out a meeting to have a meeting about having a meeting, right? So I do think sometimes, even if you aren't the boss, if you bring it up in a certain way to your boss where it helps them, I want to help you out, right? And you know how to do that. Sometimes you're able to get out of all of the Zoom meetings. Sometimes it's okay to say, you know what, guys, I gotta take a 5-minute break here as well, depending again on the type of meeting that you're having. We've done that within the 10K Project. Like, hey, 10-minute break, everyone goes, you stretch, you get your coffee, your tea, whatever, and then you come back for more of a strategy session. So I do think taking our health into our own hands, like those are the little things that we can do as well. Dr. McDonald?
Oh, go ahead. I was gonna say, when you mentioned technology and we talk about the holidays and not being able to be with our loved ones, and I am an introvert by nature, but I love to entertain. Go figure, right? It gives me the most joy. I throw the best parties ever, right? But I haven't been able to do any of that. So because that's something that gives me joy, of course, I'm feeling the emotionally effects of that, right? Because I'm not able to do that. But so for the holidays, we've talked about what we were going to do. And obviously, it doesn't entail anyone coming here. And I'm not going anywhere. So my answer was, well, if you want me to participate, we have to figure out something technology wise, right? So let's get on a Zoom, let's play some games, maybe we do something creative, because we have the ability, all of us we have the ability to create amazing, fun things if we just step outside of the norm for a moment and just give ourselves an opportunity to be creative. And so that's what my family is going to do this year. We've already said we're not going to be together. And so, but we still want to be together, right? So my mom's going to be able to log into Zoom and the family's going to be able to log in and we will do something fun. So we're going to play games and maybe we'll still say our grace together, so bless all the food we'll have in our individual homes, still go around and say all the things we're thankful for, especially this year, right? All the things we're thankful for, because we can't forget that with all of the sadness. And just still find a way to be together, even though we're not in the same space. And so I recommend families try to do that because we don't want to isolate ourselves, right? We can still engage with each other through, picking up the phone. I know that's not a big thing anymore, right? But pick up the phone and actually talk to someone versus texting so that people can still feel the comfort and the warmth of another human. but not just be physically together.
So Anna, you are absolutely right. You're absolutely right. We've had to learn how to really sit back and evaluate how we're doing things, you know, in the middle of this pandemic. So, you know, while we're on Zooms all the time at work, yes, sometimes Zooms can really be fun. You know, it's not just about work, it's just about, you know, family members getting together. You know, this is going to be hard on lots of people. You know, Thanksgiving, Christmas, people look forward to that time of year to kind of to kind of rejuvenate themselves and, you know, in the year. But it's going to be very different. And as you guys said, you get zoomed out. Your kids who are in virtual school get zoomed out too. So I always say, in between their classes, let them get up and get the ants out their pants. At least for about, you know, 5, maybe 10 minutes. Okay. But also be careful for your kids. What I've learned with my patients and my own children, when you're in school, you don't get up after every class and you're going down to the cafeteria to find something to eat. But when you're at home, that's what our children are doing. They're in that kitchen all day long. Now, we want our children to eat, but we need to have healthier options around the house. You know, we need to have more, you know, fruits, vegetables, get rid of the juices and the sodas. You know, not to say they can't have Doritos and cookies and chips, but that shouldn't be all the time. And it should be less of that and more of the healthier foods, because not only are we picking up some pounds, sitting home all day, our kids will too. So you want to keep an eye on that. So make sure they get their ants out their pants in between their classes.
Yeah, the quarantine 15 is real. I know it personally. So, you know, some of us are, of course, taking the Family Wealth Challenge, but some of us also want to take the Family Health Challenge, you know? So if somebody within 10K wants to launch that, I'd probably be one of your people to say, okay, you know, we're going to have healthy eating until the end of the year, including Thanksgiving and Christmas, right? I think it's totally possible. Somebody else mentioned vitamin D. Oh, D'Antonio mentioned vitamin D is super important as it gets darker and colder. We need to still make time to get outside and get some sunlight. I agree. It says prenatal, but you know, like my multivitamin. So I have an iron deficiency and this helps. So this is on my desk so I don't forget to take it every day. I'm like good with and that's like a high quality multivitamin there. So, you know, yeah, you gotta do it all.
I wanted to ask the doctor a question.
Yes, of course.
About some, you know, we talked about being online and whatnot. And are there any things we can do, exercises and things like that? We kind of talked about some of the food choices and things like that. Are there things we can actually do? Because I know, you know, we got to be here, you know, because this is how we are keeping ourselves safe. So are there any particular motions or moves, you know, we could do?
Absolutely. I mean, some basic things. You can get a jump rope from the dollar store, a hula hoop. You know, very thing, you just need some space in your house to move. You know, you can find some great exercise videos on YouTube.
YouTube is
where somebody just mentioned in the chat, where you don't really need weights or anything. You're just using the resistance of your own body weight, right? So you can do all of those things. And then some people have tons of workout stuff in their basement they have not used in years. Now's the time to use it. Now's the time to use it.
Certainly can't find it in the stores now.
Exactly. Take a walk around the block. Pick up jogging. You know, do all of those things. Really, you just need to do something to get your heart rate up and make you sweat. So that could be anything. That could be dancing. That could be walking. That could be jogging. Like I said, good old jump rope, hula hoop. All of those things are things that you can absolutely do right around the comforts of your own home.
Yeah. And if you live in an apartment, then you can do low impact. There's a lot of low impact, high intensity. Also, when I lived in an apartment, the stairs as well. I used to walk up and down the stairs like 4 or 5 times, and I
Mhm.
lived on the 6th floor.
Mhm.
So, you know, you do that 4 or
Yeah.
5 times.
Yes.
Like that's a workout there as well. So, Capri is saying do the wobble 3 times.
Anything that gets your heart rate up and gets you sweating
Gets
works.
it up and
Get those hustles, guys.
and I will say this as well. If anybody, so I've been wanting to do this story for Black Money Daily. It just has gotten pushed back. After the pandemic, the virtual at-home workout space as an industry is expected to grow and not decline. So if that is your industry, and you need like a part-time thing to do, a side hustle, whatever, it is not too late to get in. Do some research on it, but that industry is expected to increase, not decrease after this whole thing is over. Latrice has a final thing, and then I want to make sure that Eric and the others don't have final questions. But Latrice has said, my grocery bill has skyrocketed since my 2 teenage boys have been home.
Yeah.
So you mentioned the fruits and the vegetables, but some of us say, ouch, that's so expensive.
I want look around your neighborhoods and see if there's a local produce junction, you know, somewhere where you can go. But we've got to cut the sugar. We have got to cut that sugar out of our diet. So I implore you all to find your local produce junction, because it is more expensive in the supermarket. But we've got to get those fruits. We've got to get those vegetables. We've got to get those lean, foods into our diet. We really need a plant-based diet. And if we are eating chicken and poultry, it has to be lean, grilled, not fried. Now, I love fried chicken, but I can't eat it all the time, right? So I'm more eating grilled chicken, right? Or baked chicken breast instead of frying it. But every once in a while, I do get some fried chicken.
But yeah, fortunately, that's not my vice. So I'm more of a chocolate girl. That's my problem.
Yes.
But I
yes.
do want to, first of all, thank you so much, Dr. Keisha, Eric, Tawana. Do you have any final questions for the doctor before we all go?
Well, I know I wanted to ask about that plant-based diet. That was something I started to do just before everything started, and it kind of helped me out here. Are you finding though that because things I've been reading is that sometimes that you can still miss some nutrients with that?
So you have to be smart about it, right? So you have to do your research again. Talk to your doctor, making sure that you're having that fine balance, because when you're eating a plant-based diet, you want to make sure that you're getting adequate protein, into your meals, and if you don't want to do chicken or beef and things of that nature, you can do, Greek yogurt, you can still do your eggs, you can still do, you can still do beans, you can still do those things, but it does take a bit of research and some self-education trying to figure out how to get that balance. And of course, talking to your doctor.
Well, that's been the rub. A lot of times they don't want you going that route. It seems like to me, it seems like because I'm very much of a herbalist and that kind of stuff. So,
and studies have shown that plant-based is healthier, right? But I still, I still eat some chicken. I still eat fish, but it has to be healthy. It has to be healthy how you prepare it.
Understood.
Dr. Keisha, I do plant-based, so I just have a chocolate fetish, but I can talk to you about it and my experience. I will say that a strong multivitamin, like a good multivitamin that really absorbs through your body, it will help with that as well. So, but it is better. And anybody else who wants to know about it, if enough people email me and say, hey, can we have a special session about the plant-based thing, then, we'll bring somebody else on who's more of an expert than I am. I have a client right now who is an expert in that. So I can call him and his partner who's a doctor and see if they would come on and talk to us about the plant-based thing. So.
I'll sit that one out. Sure.
So Ayana's saying, can we stay on to 7:30? I think everyone has a lot of questions for the doctor. Well, let's ask the doctor. I mean, I didn't want to assume. Y'all know how I am about making sure we respect your time. Doctor, is it okay if we keep you on for another 20 minutes, or do you have to go?
I got another good 10 minutes.
Another good 10 minutes.
Yes.
Okay.
Yes.
If you have your questions, yeah, let's take 3 more questions for the doctor then. So Michael is asking, how do you feel about herbal medicine?
So good question, Michael. So I am I'm a physician, and I do evidence-based medicine. Issue with herbal medicine is there's not a lot of research around it. So if I don't have the data to support it, it's hard for me to really say, okay, try this, try that, without having the information about, the potential side effects and things of that nature. So yes, herbal medicine does work for some people, but when I'm practicing medicine, all of mine is pretty much database and fact-based. So I really need to have the data, the statistics to support what I'm telling you to go out and what I'm telling you to go out and to try something. I need to know about the potential side effects. I need to know what has been documented as as the benefits of it.
Okay, Ryan is asking, how do you feel about the Sinclair method to battle alcoholism, depression, and severe anxiety?
So, Ryan, that is a good question. I have to look into see what the Sinclair method is. And, once I look at that, I will be able to answer that question. So I'll have to circle back to that question for you, Ryan.
Yeah, I've never heard of that either. So Ryan is at that HBCU. So, he's getting all the knowledge over there. So any other questions? We have time for one more question. Ayana, did you have a question? You want to round it out for the doctor? Okay, well, I don't see a question from Ayana. If something comes in the next minute, we'll let Ayana be. Oh, Katie's asking best pain medicine to take, or best pain medicine to take, I guess is her question. What is the best pain medicine?
Yeah, so
not narcotics. She's saying not narcotics.
So really, depending on what kind of pain it is, but we start off with the basic anti-inflammatories. So we start with Motrin, which Motrin is tried and true. So I would say start off with that first. Now, if someone's having back pain, then because I'm looking as it's popping up, then some of that may require some physical therapy. Right. But the anti-inflammatories is still, is going to be one of the main things that we suggest. Yeah.
And Ayana's saying, don't have a question, just writing everything down that the doc is saying. Yeah, we're going to have to. So we have our rotating group of speakers that we want to invite back. And Dr. Delena is definitely on our list to come back, like every 6 months, we're going to beg her to come back.
Absolutely. And I'm sorry, Dr. Wardlaw, I don't know what happened with her technical, what happened tonight, but she'd love to come on too, because remember, I go from 0 to 21, and she goes from 7 to 107. So when we're both together, then we cover the whole, we cover the whole spectrum.
So we're going to have you come back just
absolutely
before the summertime so we can get in those bikinis or whatever we're trying to do.
Absolutely. Absolutely.
Okay. Tanya is asking, any natural methods for getting a more restful sleep?
So really, I tell all of my patients, you really just have to train yourself. If there's no underlying issues that's caused you to have lack of sleep, for instance, pain, or anxiety or depression, things that need to be treated, you really need to focus on what we call sleep hygiene, making sure that you are turning off these computers at a decent time, not sitting in that bed on your laptop, right? Yeah. Turning everything off at a certain time. Don't fall asleep with the TV on, right? People think, oh, I'm sleeping with the TV on, but those lights, those sounds, even if the TV is down, the lights going across the screen is still distracting to your brain. So you want to get into a routine. You want to get into a routine where every night you're kind of training your brain. Once you turn everything off, you get in that bed. So that means laptops, TVs, phones, everything. And you're just training your brain to go to bed around the same time every time. And really, if you do that, again, if you don't have any underlying problems that you really need to address, then you just want to train your brain every night to go to bed, and you want to train because your body works off of cues. So your body needs to know you're getting into that bed 10:30, 11 o'clock, whatever time it is. At a certain time, the brain knows it's time to go to bed. It's time to go to bed. Just like you go in the bathroom, you know it's time to go to the bathroom. You go into the bedroom, you want that signal to start to develop. You say, okay, it's time to go to bed.
Yeah.
I know for me, people ping me all sorts of time because, you know, we also do business on the West Coast. So
Yeah.
I've had to leave my cell phone downstairs,
Yes.
you know, and it was painful in the beginning. I mean,
Yes.
let me tell you, it's painful, but then you do get a great night's sleep. So, so we want to thank you again for being here. We want to invite you back. I'm going to coordinate with you and your sister to come back before the summertime.
Absolutely.
To chat with us again. Everybody, our health is so important in this wealth building journey for us and for our families. I tried to do some research with regards to, you know, a sick person and how much money they spend, but I couldn't find the stats directly. But just know, if you have chronic illness, if you don't have chronic illnesses and you get them, that is going to take money out of
Yep.
your wealth building activities. So
Yes.
that's the reason why we're having this conversation. If you do have chronic issues and you get better and you can reduce your dosages of medicine and things like that, that's more money that can go into investing in wealth building. So there's a direct correlation for us. And the 10K project is about us looking at each other as whole people and not just how much money we can get out of you and you can invest in other businesses and all of that. That's not us at all. You all know our hearts. So thank you so much for being here tonight, for, you know, talking to the doctor, having all your questions. We will see you next week to talk about the Family Wealth Challenge. Good night, everybody.
Thank you all.
Thank you for having me, everyone.